I'm Dr. Linda Ehlers, and I'm a licensed chiropractic physician here in Illinois. I have a diplomate in pain management. I also have a diplomate in diagnosis and internal disorders. If you don't know what a diplomate is an award that's given to physicians who have studied above and beyond their doctorate level degree. In addition, I'm a founding board member of the American College of Addictionology and Compulsive Disorders. Back in the early 80s, we formed the ACACD to help substance abusers with acupuncture and nutrition. The ACACD now has graduates in all 50 of the United States, and also we teach classes in Europe. With the ACACD, I taught internationally classes on neurology, acupuncture, and nutrition. Thank you. I started doing acupuncture in 1981. And in 1985, I, working with a number of other doctors in the United States, including Dr. Jay Holder, helped found the American College of Addictionology and Compulsive Disorders. I was a faculty member and taught internationally, and am still on the board. Actually, I'm vice president. What the ACACD is all about is treating drug users without the use of drugs. In my opinion, to treat a drug user with a drug is an oxymoron. It's just replacing one style of addiction with another. So in my office, we specialize in doing treatments for substance abusers that really help them get their life back. What you're about to see in this video is a discussion of the types of testing and evaluation that we do here in the office. Pay close attention to the discussion about the neurological evaluation and the neurotransmitter evaluation. At the end of the DVD is a phone number for the office. If you'd like to come in and make an appointment, please call that number. We'll get you set up as soon as possible. Thank you. My name is Dr. Linda Ehlers, and I'm here to talk to you about what makes my office different from every other doctor's office that you've been to. We treat patients metabolically and neurologically. And you're watching this video because you or someone you love is suffering from a chronic health condition. I'm here to tell you that no stone is left unturned to determine the exact cause of your condition. So how do I successfully treat these types of conditions? By using specific metabolic and neurological testing and treatments. Metabolic treatments here in this office are based on specific lab panels. We use specific blood tests such as a thyroid panel, a complete metabolic panel, a lipid panel, a CBC, which is a complete blood chemistry and automatic differential. And we can assess your thyroid, your adrenal glands, your liver, your kidneys, your red and white blood cells, and gut functions with these tests. All internal functions can be affected when you have a chronic health condition. By addressing any problems with your thyroid, your adrenal glands, your blood chemistry, or your gut functions, we can also help you to heal faster. The complete metabolic panel also allows me to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. We also will do sensitivity testing. This type of testing determines if you have a sensitivity to gluten, which is a very, very common sensitivity, and milk, eggs, yeast, and soy. Those five combine together to cause innumerable health problems. If you're sensitive to any of these food groups, it is making your condition worse. If you have any of the following symptoms, you could be suffering from sensitivity to gluten, soy, milk, eggs, and or even yeast. Here are some of the symptoms of these sensitivities. Chronic pain or fatigue, frequent indigestion, bloating after eating, frequent bowel movements, constipation, mouth ulcers or sores, even frequent vomiting. And the only way to find out if you are suffering from any of these sensitivities is to run the tests. We also do an adrenal evaluation using an adrenal stress index, and that further tests the glands by taking a sample of your saliva, and it's very much like a DNA test. Your adrenal glands are your stress organs, meaning that they react to stress. If you've been or are currently under stress, this test is a must. If you suffer from insomnia or blood sugar issues, this test will measure your cortisol levels. When your body's cortisol levels are abnormal, you will suffer from insomnia or problems with your blood sugar. cortisol levels can be corrected via very specific nutritional protocols. We also run immune panels. Your condition could be caused by an autoimmune disorder. As you know, an autoimmune disorder is where your immune system attacks a particular area of the body, like your nervous system or your joints or your connective tissue or your thyroid gland. So we test for specific antibodies to determine if you suffer from an autoimmune condition. We run immune panels that include T and B lymphocytes and NK cells, cytokine panels, and natural killer cell activity tests. And there are two parts to your immune system that you need to be aware of. Basically, they're called the Th1 and the Th2 portion. Th1 is your T cells, and T cells are the army that attacks and cleans up afterwards. These cells include the helper T cells, suppressor T cells, what are called natural killer cells, and regulatory T cells, and also macrophages. Th2 is your beta cells, and the beta cells are the ones that make antibodies. They tell T cells what to kill. If the testing comes back with a high B cell count, you're Th2 dominant. And you'll want to determine if there is an active antigen or any kind of dysregulation in your immune system. Active antigens are things like parasites, bacteria, viruses, mold, yeast, fungi, protozoan, foods, chemicals, and even heavy metals. The best indicator for an active antigen as the cause of your abnormal dominance in your immune system is this helper-suppressor ratio on the T and B panel that we run. Some of you might have heard it called the CD4-CD8 ratio. The closer to 2.5 the ratio is, or if it's above that, the more likely it is that you're dealing with an antigen. If the ratio is below 1.2, then you are most likely dealing with a dysregulation problem. The immune panels give me an in-depth picture as to what is exactly happening with your immune system. If you are suffering from an immune disorder, it obviously trumps everything, and it must be the first thing that I address to help you get better. We also run tests for H. pylori because this bacteria is a major cause of problems in the gut. We also run tests for your intestinal permeability, and that's testing that's used to determine if you are suffering from leaky gut syndrome. Leaky gut syndrome, or LGS, describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, a bad diet, parasites, or infection, all of which can lead to increased permeability of your gut wall to toxins, microbes, undigested food, waste, or larger than normal macromolecules. It's been proposed that these substances affect the body directly, while other doctors postulate that an immune reaction is a response to these substances. We'll also check for neurotransmitters. We actually test for decreased brain neurotransmitters because neurotransmitters are vital to the proper functioning of your brain. Decreased neurotransmitters can cause increased pain. And as you may know, I'm a diplomate in pain management. We also run hormone panels because we can check with saliva testing to determine if you're suffering from low testosterone if you're a man, or low estrogen progesterone if you're a female. Symptoms that relate to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, the infamous night sweats, weight gain, and of course, decreased physical stamina. We also test to find out if you have any inflammatory processes that are hidden or occult. And we'll test homocysteine levels and a substance called C-reactive protein. Many patients suffering from chronic health conditions suffer from these inflammatory processes, and just about every fibromyalgia patient that I've ever treated suffers from some form of chronic inflammatory process. Once we've diagnosed your problem and know exactly what's causing your symptoms, then we will phase into neurological treatments that are based on very specific neurological testing. We'll have you do a lot of exercising, but a very specific kind of exercising, because what we want you to do is exercise so that you stimulate the brain to uptake both fuel and oxygen. Oxygen is, of course, one of the key components for the brain. You know that 3 minutes without air and you die from suffocation, and that's because the brain needs oxygen that severely. You can live 3 days without water, and you can live 3 months without food, but you cannot live more than 3 minutes without oxygen. And by increasing the firing in the brain through these very specific types of exercise, what we will do is help the brain bring in more nutrition, more nourishment, more fuel, and help it heal. And this is all part of a type of therapy called brain-based therapy. And we use, in addition to specific exercises, vibration therapy. Vibration therapy will fire the back part of the brain called your cerebellum, and the cerebellum has the function of controlling the spinal muscles. We'll also use auditory stimulation, we'll use visual stimulation, we use olfactory stimulation, and caloric stimulation, the increased firing of your brain to help you heal faster. My office is equipped with a Solaris cold laser in here, and laser therapy, as I'm sure you know now, is very wonderful for helping tissue heal faster. We also do non-surgical spinal decompression. That's a type of therapy that creates a negative disc pressure and helps to remove pressure off of a pinched nerve. It also provides a slow stretch to the muscles, which fires up the spinal cord to increase firing of the brain. We also use glutathione, and glutathione is the mother lode of all the antioxidants. Glutathione cannot be taken orally. If you do try taking it orally, when it gets into the stomach deconstructs the glutathione molecule and it doesn't get to the cells. So we use a very specific style of glutathione therapy, and what I've seen is miraculous changes in the patients as a result of using this very specific glutathione protocol. Once we've run the necessary tests to determine your specific health condition and what exactly is driving it, then we can successfully treat you via proper neurological and all-natural nutritional protocols. So ask yourself the following questions. 1. How has your chronic condition affected your job, your relationships, your finances, your family, and other activities? 2. What's it cost you in time, money, happiness, and sleep? 3. Where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? 4. What is it worth to you if we could improve your condition?